So this is the provision screen. There's a click menu here for NEStrition, and once this is clicked, the NEStrition range will appear in a box. The supplements are not in a particular order. You will see here that in this case there is an energetic match for the AON's supplement. This is an energetic match only. We are not testing for any biochemical. We are mainly looking here at the energetic match. So really it's down to the discretion of the practitioner to take a full case history to ensure that this is in fact the right supplement for this person at this time. We also have a yellow here for Heplex, and it could be, once we've had a look at the case history, that this may be the more appropriate supplement. Again, because these are biochemical supplements, it does involve the practitioner looking at the case and making the decision as to which product would be the most suitable in this particular case. So this is the recommendation screen in Provision, and you can see that we have the NEStrition range listed. Again, not in priority order. This is in the same order as listed on the NEStrition screen. So you can see that the red indicator is carried over. We do not have a recommendation for the NEStrition because, as I've mentioned before, there are factors that need to be considered by the practitioner before the particular supplement is chosen. So let's talk about prescribing NEStrition. The Provision scan indicates a guide only, and it's looking at the energetic match between the NEStrition and the client. It's important to take a case history and to assess any compatibility issues, including contraindications. It's the practitioner's responsibility to ensure a safe and suitable prescription of the NEStrition products, and this also includes the practitioner being insured to prescribe herbal supplements. Once the NEStrition products have been recommended, there is no set order for taking the products. They can be taken at any time of day, with or between meals. However, as with the infoceuticals, not more than one product should be taken at one time, and there should be 10 minutes between taking the different NEStrition products, and this is because of the imprinting process that we have on these supplements. They do need to be kept separate. There must also be 10 minutes between taking the NEStrition and taking the infoceuticals. The suggested dose is 2 capsules twice daily. However, it's really the responsibility of the practitioner to advise on dosage. So we would recommend 2 capsules twice a day, or 1 capsule twice a day. But again, this is very much down to the discretion of the practitioner, and it's the practitioner's responsibility to guide the client on the dosage level. So let's just look on infoceuticals within the NEStrition. Each capsule has been encoded with NEStrition formula, and that's the absorption formula, and with a specific infoceutical formula to aid the function of the capsule. And the example we have here is the Heartbeat capsule. So Heartbeat contains ED5, EI10 and EI6. This information has been combined, and when the information is combined, you basically get a different set of information. It's not the same as the individual infoceuticals, so really you should look at these products as being a completely different energetic imprint to the drivers or the integrators on their own. For this reason, it's completely acceptable to take, for example, the ED5 alongside Heartbeat. It's also fine to take Heartbeat on the first visit, even though it contains energetic star information, because of the synergistic effect of the imprinted information when it is combined. Now, as these are biochemical products, there are some contraindications, and these do need to be highlighted in training. On the left hand side here we have some of the herbs that have been proven to have an interaction with certain medicines. It's probably not an exhaustive list, but these are the ones that have been scientifically proven to have an interaction. So these are the ones that really do need to be used with caution. They may either increase the need for the herb, or they may have a negative effect on the medication. The main medications that are affected by herbal preparations are warfarin, diuretics, antidepressives, and in some cases, most notably with the use of St. John's wort, oral contraceptives. I would very much advise that practitioners who are going to be prescribing these supplements invest in a book of herb vitamin drug interactions, so that they are very clear on which herbs may potentially interact with which medicines. And it's also vitally important that when taking a case history, current medications are always listed and compared to the NEStrition range. There are special risk factors, and these again are things that should come up within a comprehensive case history, most notably if someone has a specific allergic reaction. Again, just highlighting the need to take into account current medications. Children may have different nutritional needs. Pregnant and lactating mothers, obviously herbs should be recommended with caution to these groups, and clients with digestive system ulcers, again, caution should be used, especially when recommending any of the supplements that contain the digestive enzymes, as these enzymes may exacerbate the ulcers. Usually you would only get these effects if the herbs are taken in very large quantities, and the quantities recommended, that is 1 to 4 capsules a day, should be sufficiently low that these effects won't be encountered. However, we do highlight again that it is the responsibility of the practitioner to make sure they are adequately trained and qualified to prescribe supplements, especially to these special risk groups.